Okay. So good day, everyone. So for this week's topic, we will be discussing about transfusion reactions. So transfusion reaction, they can be divided into two categories. So we have acute and delayed transfusion reaction. So acute, okay, these are signs and symptoms or yung reaction occurs during the transfusion mismo or within 24 hours. Yung delayed naman is yung signs and symptoms is they present after 24 hours of transfusion. Okay? So yun yung pinakaiba ng acute and delayed transfusion reaction. So we could also categorize them as to immune or non-immune, tsaka infectious or non-infectious, which we will uh, babanggitin ulit later. Okay? So let's start off first with acute transfusion reactions. Okay? So we have 7 types of acute transfusion reactions. So first we have acute hemolytic transfusion reaction, transfusion-associated sepsis, and febrile non-hemolytic transfusion. Itong tatlong to, they are all febrile. Ibig sabihin, they cause fever. Okay, so fever is one of their symptoms. So itong tatlong nauna. Next, we have allergic transfusion reactions. This can be categorized into mild and severe. Next, we have transfusion-related acute lung injury and transfusion-associated circulatory overload. At ang dalawa naman is pulmonary in nature. And we have adverse events associated with massive transfusions. Okay, so let's discuss them one by one. First, we have acute hemolytic transfusion reaction. Okay? So AHTR consists of acute hemolysis with accompanying presenting symptoms within 24 hours of transfusion. So kaya nga siya acute, within 24 hours nag-show ang inyong signs and symptoms. So it can be either, ang cause can be either immune or non-immune. Okay? And this is caused by interaction of preformed antibodies in the recipient with the donor red cell antigens. Okay? So most severe reactions we have is yung ABO incompatibility. Okay? So pag ABO incompatible ang blood na na-transfuse kay patient, immediately makikita nyo yung reaction. So mabilis yung reaction nito, not more than 24 hours. Okay? Ito yung most severe reaction kapag ABO incompatible. So a small amount of incompatible blood, as little as 10 ml, 10 ml lang, it can cause rapid hemolysis na agad. Okay. So what are the symptoms ng acute hemolytic transfusion? We have fever chills, you have back pain, hemoglobinemia, hemoglobinuria, hypotension, renal failure, shock, and possible DIC. Okay, so how would we diagnose acute hemolytic transfusion reaction? So siya ay DA positive, direct antiglobulin testing positive. Okay, and then kapag mababa, decrease ang hemoglobin ni patient, decrease ang hemoglobin, increase si LDH, increase din si bilirubin, decrease si haptoglobin. Okay. So, decrease ang hemoglobin niya in testing. Why? Kasi nga, there is hemolysis. So, pumuputok si RBC. Pumuputok si RBC, so nawawalan ng hemoglobin, or decrease ang hemoglobin saturation ni patient kasi nasa plasma ang hemoglobin. That's why you have hemoglobinemia. Okay, excess hemoglobin na secrete natin sa urine, that's why you have hemoglobinuria. Okay? Decrease LDH. LDH can also be found inside our red cells, hindi ba? So, pumuputok si RBC, decrease LDH. Okay? Hemoglobin later on turns into bilirubin once it is processed, hindi ba? That's why you have increased bilirubin in your blood. Decrease haptoglobin because free hemoglobin binds to haptoglobin. Okay, decrease yung haptoglobin because excess hemoglobin in the blood binds to haptoglobin. Okay. So how would we treat ang ating acute hemolytic transfusion reaction? So first, discontinue na agad yung transfusion. Okay. Maintain vascular access, maintain blood pressure, maintain the renal blood flow, and treat DIC if present. So how would we prevent naman to? Okay, so follow standard operating procedures for identification of the patient. Why? Because the most common cause of acute hemolytic transfusion reaction is improper identification. Okay, so improper identification po siya. Okay. Why? Kasi 'di ba ang most severe reaction dito or most commonly na din na may acute hemolytic transfusion reaction is yung ABO incompatibility. So, mangyayari lang naman na ABO incompatible ang blood kapag kayo maling patient yan na transfuse. Hindi naman yan makakalusot ng cross-matching na ABO incompatible. Okay? Yun. So, proper identification of patient. Next we have acute. Okay, sorry. This is acute non-immune hemolytic transfusion reaction. Okay, correction. Acute non-immune hemolytic transfusion reaction. Okay? Yeah. Okay. So this most frequently presents as asymptomatic hemoglobinuria. Okay? Occasionally associated with renal dysfunction and rare related death has been reported. So it can cause biochemical damage or mechanical damage such as improper shipping or storage temperature, incomplete deglycerolization ng frozen RBCs, small bore of needle use, small bore, so it can cause trauma sa RBCs. Kasi mataas yung pressure tapos maliit lang yung dinadaanan nila, so it can cause trauma which can cause hemolysis sa dun sa blood component. Yun. So you have improper use of blood warmer kapag hindi tama yung temperature ni blood warmer too high probably. So yeah, it can cause damage sa blood component. Okay, that is non-immune. Again, this is acute non-immune hemolytic transfusion reaction. Okay, non-immune meaning hindi siya it is not caused by antigen antibody reaction. So, non-immune. Okay. So, what are the symptoms? This is asymptomatic. Okay. So, asymptomatic, meron ka lang hemoglobinuria. Okay. Kasi may hemolysis pa rin na nangyari due to the following technical factors na nabanggit kanina. So, may hemolysis, so you have possible hemoglobinuria. So, ilalabas lang ng katawan mo yung excess. Okay. So, wala siyang symptoms din. Walang symptoms and it is not negative for the diagnosis. So, treatment is discontinue transfusion. Okay. Then, maintain vascular access, maintain renal blood flow, and then follow standard operating procedures for equipment operation naman sa ating prevention. Next, we have transfusion-related sepsis. Okay. So, this is transfusion-related sepsis or kaya transfusion-associated sepsis. Pares lang yan. Okay. So, this is an acute non-immune transfusion reaction presenting with body temperatures usually 2 degrees Celsius or more above normal temperature. Okay, rigors can also be accompanied by hypotension. So, you have ang symptoms, you have your hypotension, rigors, and fever. So, yun na. May tatlo ka ng symptoms. So, it occurs when a bacteria-contaminated blood component is transfused. Okay, kaya nga siya sepsis, so may infection. It is caused by bacteria-contaminated blood components. Okay, so mortality risk include yung contamination by a gram-negative bacilli, patient age, volume transfused, and platelet storage time. So, sources of bacterial contamination, you have skin flora. So, hindi proper aseptic or hindi na-sterilize probably yung during nung blood collection. Okay? Or kaya naman gut flora associated with transient bacteremia in an asymptomatic donor. Si donor pala is fighting an infection. Okay, pero asymptomatic siya. So, siguro pagaling na, probably. Kaya na siyang lagnat, ayun, nag-donate siya ng blood. So, pwedeng pa rin mag-cause yun. Okay, or may bacteria pa rin na nakuha sa kanya. Kaya, bacterial endotoxins generated during storage. Okay? Ayun. So, bacterially contaminated platelets are considered the most frequent component causing transfusion-associated sepsis. Okay? So, as you remember, si platelet is room temperature lang natin siya ini-store. So, room temperature, kaya if ever there is bacteria present in them, so hindi siya na-fight off ng temperature. So, freely growing lang sila sa temperature na yun. Um, unlike for other blood components na nasa ref or nasa freezer, so hindi nagta-thrive ang bacteria doon. Okay? Kaya ang most common blood component na bacterially contaminated is yung platelet. Kasi again, room temperature lang natin sila ini-store. Okay. So for the symptoms, you have fever, chills, hypotension, and shock, as nabanggit ko kanina. Okay, for the diagnosis, this is DOT negative. Okay, DOT negative siya. Okay, you can gram stain the blood bag. Okay, or kaya culture natin yung blood bag. Or kaya culture ng blood sample ni patient. Okay, that's how we would know or we could confirm that this is bacterially caused yung kanyang naging symptoms. So, treatment is discontinue first yung transfusion. As always, kapag nagkaroon ng reaction si patient, discontinue palagi yung transfusion. Maintain vascular access and then consider na yung broad spectrum antibiotics. For the prevention, follow standard operating procedures for collection kasi sa collection siya most probably na infect or nakuha yung bacteria. And then implement bacterial detection intervention prior to transfusion. Next, we have febrile non-hemolytic transfusion reaction. So this one is an acute complication presenting with at least 1 degree increase in body temperature. Okay, 1 degree increase, at least 1 degree increase in body temperature. So an increase in body temperature in a hypothermic patient to normal body temperature should not be considered to be FNHTR. Okay. So this can be caused by a white blood cell related mechanism. Okay. So immune mediated and is due to the presence of preformed antibodies reacting against white cells in the blood component. So for febrile non-hemolytic because it does not involve the RBC. So ang involved here is the white blood cells. Okay, this is related to platelet storage changes, so which involves the production and release of biologically active cytokines. Okay, so those cytokines then attack the white cells of the recipient. Another symptom nito ay meron din siyang chills, yung shaking chills. So you have fever, chills, nausea, vomiting is also present. You have tachycardia, tachypnea, and increase in blood pressure. Siya naman is DOT negative. So how would we treat? Treat with antipyretics para sa febrile. And then for the rigors naman, treat with meperidine. Okay? So, ang prevention natin, we can use leukoreduced PRBC and platelets. Next, we have allergic transfusion reactions. So this one occurs as a response of recipient antibodies to an allergen present in the blood component. So allergic nga, as the name implies, so allergen present ang ating dinidetect or ang nagkakos. Okay? So it can range from minor urticarial effects to fulminant, anaphylactic shock, and worst is death. Okay? So pathophysiology, this is due to activation of mast cells in the recipient triggered most frequently by an allergen present in the plasma of the blood component. Okay? So merong allergen na present in the blood component na allergy patient doon. So ma-activate si mast cells which will is responsible for the allergic reaction. Okay? So meron ng preformed antibodies. So patient preformed antibodies, IgE antibodies, interact with the donor-derived allergen. Okay? Okay. So for mild, so this allergic reaction can be classified into mild and severe. So sa mild, you have wheals, hives, erythema, pruritus lang as your symptoms. Ito yung mga pantal, mga ganun lang. Yun yung allergic mild reaction. So clinical diagnosis of that is not required at this point. For the severe naman, okay, so these are the symptoms ng severe. So you have angioedema, okay, sa preorbital or kaya sa tongue swelling. You have bronchoconstrictions or wheezing. Okay, so nahihirapan ng huminga si patient, meron ng bronchoconstriction. You have gastrointestinal symptoms and yung cardiovascular instability. So it can cause hypotension, cardiac arrhythmia, pwedeng loss of consciousness, shock, or kaya cardiac arrest. Okay? So for the diagnosis, this is that negative. And IgA deficiency workup when indicated. So you can also do IgA deficiency workup. So how would we treat the allergic mild reactions? So temporary, discontinue yung transfusion. Okay? So treat with antihistamines, and then if symptoms are improved, you can proceed with the transfusion. Okay? So for to prevent this, so for repeated reactions, consider na yung pre-medication and antihistamines. So kung sensitive talaga si patient, so unahan na ng antihistamines and then blood transfusion. Okay. For severe naman, so discontinue transfusion, itigil na talaga. Okay, huwag nang i-transfuse yung blood, maintain vascular access, and then treat with subcutaneous epinephrine. So epinephrine is important since it pwedeng mag-anaphylactic shock si patient, totally mag-close off yung kanyang bronchus, so hindi makakahinga. So, importante yung epinephrine. So, maintain blood pressure and then provide respiratory support. Okay? So, for severe allergic reactions, for IgA absolute deficient patients, dapat IgA deficient blood components lang din yung itatransfuse to prevent the allergic reaction. So, IgA deficient blood component. Next, we have transfusion-related acute lung injury. Okay? So this one, it consists of an acute transfusion reaction presenting with respiratory distress and severe hypoxemia during or within 6 hours of transfusion in the absence of other causes of acute lung injury. Okay? So accompanied by fever or kaya naman ay hypotension. So this one is now considered the leading cause of transfusion-associated fatalities, so surpassing EBO incompatibility and bacterial contamination. So again, this is the number one cause na ng transfusion-associated fatalities. So there can be two causes or pathophysiology of TRALI. So we have immune TRALI. This is antibody mediated. So antibodies against the HLA or HNA in the transfused blood component react with recipient leukocytes, causing aggregates that occlude the pulmonary circulation. So antibody mediated. Okay, so HLA or HNA antibodies react with the recipient leukocyte, then it causes aggregates, which blocks the pulmonary circulation. Okay? Pag non-immune naman, non-immune is results from the priming of the patient's neutrophils. Okay? So, activation ng primed neutrophils. Okay? So, what are the symptoms of TRALI? Okay? So, you have severe hypoxemia, okay? Yung aggregates nagbo-block sa pulmonary circulation, so nahihirapan huminga si patient. Okay? So, pero there are no evidence of left atrial hypertension. Okay? For the diagnosis sa chest X-ray, the patient, you can see bilateral infiltrates. Okay? You can do donor tests for HLA, HNA antibodies, and then recipient test for HLA, HNA antigens. For the treatment, of course, discontinue transfusion as always. Maintain vascular access. So, you need supplementary oxygen. And if hindi na talaga kaya, mechanical ventilation na. Okay? For the prevention, you can use male-only plasma or exclude or screen female platelet donors. So, why is that? Okay, let's go back. Ano ba yung HLA, HNA? HLA stands for human leukocyte antigen. HNA stands for human neutrophil antigen. Okay? HNA precise or specifically this can be developed by female patients after pregnancy. Okay? So pregnancy is one of the factors. One of the factors, hindi lang siya yung factor ha. Okay? Pregnancy is one of the factors why a female patient can develop HNA. So that's why as a prevention, we can use plasma coming from male. Okay? Kasi nabawasan na ng one factor, which is the pregnancy. Yun. Para less chance na yung sample is with HNA or HLA antibodies. Okay? So, para lang mabawasan yung factors, hindi totally mawala. Okay? Kasi again, pregnancy is only one of the factors why someone can develop HNA antibodies. Okay? So, as a prevention for transfusion-related acute lung injury, we can use female or we can exclude female patients or use only male plasma so that we can erase or matanggalan natin yung factor na pregnancy na nagko-cause ng HNA antibodies. So, less chance na yung sample causes antibodies that might react with the recipient leukocytes. Okay? Okay. Okay, let's proceed. Transfusion-associated circulatory overload. Okay? So this one occurs when the patient's cardiovascular system's ability to handle additional workload is exceeded, manifesting as congestive heart failure. So TACO, or transfusion-associated circulatory overload, is also associated with increased morbidity and mortality. Okay, so what are the symptoms? Okay, you have severe hypoxemia, you have cough, headache, chest tightness, and increase in blood pressure. Then, jugular vein with distension, increase ang central venous pressure. So, why is that? Because kina-overload as an implies na yung circulatory system ninyo. Okay? Pag nagtatransfuse ka ng blood, so dumadami in the sense, okay, parang dumadami in the sense yung blood mo, di ba? So, dumadami siya, lumalapot, and so on. So, it increases pressure sa cardiac circulatory system. Okay, yun. So, pag sobrang dami na yung na-transfuse kay patient, it can cause overload. Okay? So, for the diagnosis, you can use chest x-ray ulit. We can see pulmonary edema. We can see cardiomegaly, distended pulmonary artery. Kasi too much pressure on the brain or masyado ng on the brain, sorry. On the heart, okay, or kaya distended pulmonary artery kasi ayun nga, yung caused by the pressure and nung excess workload sa patient or sa heart. Sorry. Okay, we also can use brain natriuretic peptide as a test for to confirm TACO. Transfusion-associated circulatory overload treatment. So we can use upright posture can help to relieve the symptoms. Okay, and then supplemental oxygen and then diuresis. Okay, for prevention, we can use lower transfusion rate or transfuse in smaller volumes para makatulong mo ng makarecover yung heart before mag-transfuse ulit. Okay. So that's it for acute. Let's proceed with delayed transfusion reactions naman. Okay? So first, we have delayed serologic or hemolytic transfusion reaction. Okay? This one is defined as the detection of new red cell antibodies after 24 hours of transfusion. Okay? New red cell antibodies. Okay? So, it may be discovered when a new sample is tested during a request for a type and cross match and the hemoglobin levels are lower than expected for the transfusion interval. New na tinutukoy dito, new meaning new antibodies na hindi na-detect nung unang beses. Okay? So for example, patient, na-requestan ni doctor for a blood transfusion, so type and cross match. So, kunyari, walang na-detect na antibody, so tinransfuse si patient, tinransfuse yung blood, and then after 24 hours or so on, nagpa-type and cross-match ulit si doctor. So, another batch naman ng cross-matching. Tsaka pa lang na-detect yung antibodies na yun na meron pala siyang ganun, hindi na-detect noong una. Yun yung new na tinutukoy. Okay? Hindi siya newly formed. Newly detected lang. Okay? Okay. So, symptoms niya is asymptomatic. So, wala naman siyang grave symptoms. Patient can only experience fatigue. Okay. So for the diagnosis, we can detect this using DOT. So positive siya on DOT or positive siya sa antibody screening. Okay. Decrease ang hemoglobin. Okay. Decrease ang hemoglobin niya kasi this is still hemolytic. Okay. Hemolytic pa rin siya in nature. So although it is asymptomatic, it can still cause hemolysis. So, dagdag natin sa asymptomatic since this is hemolytic. So, we can also see hemoglobinuria, syempre. Okay? So, treatment naman, you can treat as needed. Okay? So, we can also transfuse antigen-negative AHG cross-match compatible packed red blood cells. For the prevention, you could do accurate record keeping, okay, obtain transfusion history ni patient, okay, then limit transfusions. So, accurate record keeping para once na mangyari ulit to or once na magpapatransfuse ulit si patient, you have a record na nagpa-positive siya for this antibody before. Yan. Okay, kasi baka this time hindi na naman siya ma-detect. Okay, and so on. Yan. Ay, sorry. Saan na ba ako? We have delayed hemolytic transfusion reaction. For this one, it's delayed serologic transfusion reaction. This one is delayed hemolytic transfusion reactions. For the symptoms, you have flu-like, pallor, and jaundice. So you have pallor, so maputla si patient, decrease in hemoglobin, and then jaundice, increase si bilirubin. Okay. For this one, same treatment and prevention lang with the other one. Next, let's proceed with the transfusion-associated graft versus host disease. Okay. This is defined as a delayed immune transfusion reaction due to an immunologic attack by viable donor lymphocytes contained in the transfused blood component against the transfusion recipient. So this one, okay. So HLA antigen difference. This graft versus host disease can be caused by HLA antigen difference between donor and recipient, or kaya presence of donor immunocompetent cells in the blood component, and then yung recipient is incapable of rejecting the donor immunocompetent cells. So graft versus host disease, okay. So the lymphocytes or the donor lymphocytes attacks the host cells. Okay? So, nagkakaroon ng immunologic attack by from the viable donor lymphocytes in the blood component against the recipient. Okay? Possible niyan because si merong present na donor immunocompetent cells in the blood components. And then yung again, yung lymphocyte from the donor is immunocompetent, hindi kayang labanan ni host or ni recipient. Okay. Baliktad. Usually, di ba, ang transfusion reactions, yung body natin ang nagre-react sa blood component. Okay? Yung body natin, yung may ayaw sa blood component. Whereas in the transfusion-associated graft versus host disease, yung blood component ang may ayaw dun sa recipient. Yung blood component, yung umaatake dun sa recipient. Okay? So we have, okay, for the symptoms, you can have maculopapular rash, you have fever, watery, diarrhea. And then for the diagnosis, we can see pancytopenia, elevated ang liver function tests, and we can also identify donor engraftment. For the treatment, there are no treatments available, but we can prevent it by using gamma irradiated blood component. Not last. Next, we have post-transfusion purpura. Okay, this one is defined as a delayed immune complication of a transfusion that presents with profound thrombocytopenia. Okay, so mababa si platelet count 1 to 24 days after ng blood transfusion. This occurs when a patient who is previously sensitized to a human platelet antigen by pregnancy or transfusion is re-exposed via a transfusion. Okay. So, patient or si recipient is previously na-sensitized na siya sa human platelet antigen during pregnancy or sa na-transfusan na siya ng blood before. So, na-sensitize na si patient. Ngayon, tinransfusan ulit siya this time meron na siyang pre-formed antibodies. So, yun yung nagre-react which causes the thrombocytopenia or the purpura. Okay? So, yung symptoms natin, we can see bleeding. Okay? So, bleeding. And then, bleeding since we have thrombocytopenia. Okay? So, decrease platelet count. We know that platelet count plays an important role in coagulation. Okay? So, without platelet count or low platelet count, so affected si coagulation, walang proper coagulation can cause bleeding. Okay? So, diagnosis, okay, pag thrombocytopenic si patient, we can use that as a factor for the diagnosis. And we can also check for HPA antibodies, human platelet antigen antibodies. For the treatment, we can inject intravenous immunoglobulin. And to prevent it naman, limit ang transfusions. Since may pre-formed antibodies na nga siya, okay, so limit na yung transfusions. Kasi most probably, yun at yun talaga yung mangyayari. Okay. Lastly, we have iron overload. Okay. This one is a delayed non-immune complication of transfusion presenting with multi-organ damage secondary to excessive iron accumulation. Okay. So each unit of red cells contain approximately 250 milligram ng iron. Okay. So after 10 to 15 red cell transfusions, so we can see this yung ganito karami siguro sa mga major surgery, sa mga patients na may hemolytic anemia, or yung mga nagda-dialysis, yung talagang consistent na kailangan nilang magpa-transfuse ng blood. Okay, so we can see this, atong iron overload sa kanila. So excess iron na nanggaling sa blood transfusion, napupunta yun sa liver, sa heart, saka sa endocrine organs. Okay? So, yun, kapag mayroong iron accumulation doon, it can cause multi-organ damage. So, symptoms you have your multi-organ failure, then high ferritin levels, pwede natin makita kay patient. For the treatment, use iron chelating agents. Okay? And then, prevention, prophylactic use na ng iron chelating agents. Okay? So, unahan na yung before transfusion, so you have your iron chelating agents. Yeah. Okay. So, that's it for our discussion this week po. So, if you have any questions, you can message your respective instructors for your questions, or you can message me din naman po. Okay? So, thank you. Have a good day and God bless po.